other injuries that you can sustain from your neck. The other thing would be like a motor vehicle accident. If you're rear-ended by someone behind you, a lot of times what can happen is something that everybody knows about, which is whiplash. Whiplash involves the forward and reversing of the head, going forward and backward kind of rapidly, maybe not a million times in a row, but pretty rapidly enough that can cause pain. So when that happens and the head is jerked back and forth, those muscles in the front and the back of the neck and also around the neck can be strained, and that can cause a lot of headaches. Those headaches aren't the ones that come and go quite infrequently. They're headaches that can actually come more so on a daily basis. So overall, what are some symptoms that you should be aware of? Decreased mobility of the neck. So all of a sudden you can't turn your head to look when you're driving, you can't bend down to kind of look below you, or you can't look up to the ceiling, those kinds of things. The other thing you should be wary of are headaches. You can get headaches by a motor vehicle accident, but you can also just get general headaches when certain muscles are getting too tight. So when these muscles, especially in the back of the neck, get super tight, they're really small, but as they get tighter and tighter, they actually can radiate pain up the back of your neck and to the side. Pain with holding your head in a prolonged position. Hence, all of those times we're sitting either reading a book, looking down for a really long time in bed at night, or kids and adults who are spending too much time on electronics, going like this. When you're staying in this position for a really long period of time, you're causing a lot of issues with your posture in your neck, and that's something we should be definitely more aware of. Now, sometimes you have pain in your arm and you don't have any pain in your neck. We have a lot of people that come in for neck issues all the time, and they just don't quite understand how they don't have any neck pain. Now, the reason they don't have any neck pain is because it's a nerve impingement issue. And if the nerve is put onto an impinged position for a really long period of time, most likely most of their symptoms will actually be in the arm. And that's because all those nerves that branch out from that spinal cord that go down actually go down your arm in different areas. And depending on which level is affected will determine which part of your arm or your hand is affected as far as pain, numbness, or tingling. Pain can also radiate into your shoulder blade and can radiate upwards. Now, there are different things called knots and trigger points that can be addressed, because as muscles get tight, you might just have a knot there. But if the muscle gets tight and someone comes and pushes on that muscle and all of a sudden you feel pain kind of not in the same area and it starts to radiate somewhere else, that's more of a trigger point, and that's something we can address as well. So what would happen if this wasn't handled? Pain will then begin to limit your ability to do normal things like getting dressed, bathing, doing things in the kitchen, cleaning your house, driving, all those things. Permanent nerve damage can occur. Over a period of time, as more and more compression of those nerves occur, there will be a point in time where no matter what is done, that nerve has been compressed so long that the damage is done and we cannot reverse any of those symptoms. And because of that, obviously, we go into the other thing, which is surgery, and that means the actual surgeon will have to go into your neck, release the compression. And even at points of time when someone goes into your neck and does surgery, that doesn't always result in 100% recovery. So what can physical therapy do to help you with this? What we can do is increase your range of motion. We can help with postural exercises that can stretch those tight muscles and strengthen those weak muscles. We can help with the balance of the musculature to make sure things are proportionally positioned and worked on. Manual therapy, and that can entail anything between soft tissue mobilization, trigger point release of those knots that produce pain elsewhere, or we also do manual traction where we pull on the cervical spine a little bit there when you're on a laying down position, and that opens up the space where those nerves are and where the disc material is, and that can help release some of your pain. We spend a really good hour with our patients during an evaluation process, and that is to educate the patient about what is going on. Show pictures, explain different exercises we want you to start with. If you're interested in learning more information about having neck pain and you want to seek the help of a physical therapist, go ahead and click the link below for some more information.